Today I want to discuss with you an interesting case we had recently of a dog with bladder stones. So the dog came in for straining to urinate. Dr. J saw the case and immediately recognized there may be a urinary obstruction and took an x-ray. And so we're going to look at the x-ray here. As you can see, we're looking at the dog from the side. There's two very, very large bladder stones. In addition to those large stones, there's smaller stones here in the urethra, those little bitty stones there that were blocking the urethra and made it impossible for this dog to urinate. So he was just dribbling urine. Those were the signs and symptoms he was having at home. And so he needed emergency surgery in order to alleviate that obstruction. So Dr. J went into the abdomen, exteriorized the bladder, went in, got these large stones out. One of the most impressive things about this case is that the stones were so large for the size of the dog. This was an 8-pound dog, and these stones were as big as golf balls, and there were 2 of them. So those are really impressive sized stones for a dog that size, but she was able to flush these smaller stones back up into the bladder and remove the larger stones and the smaller stones and alleviate the obstruction. So he did really well, went home happy and able to urinate normally. What we do with these stones after the fact is we send them to a lab at the University of Minnesota, and they analyze those stones. They tell us what they're made of, and they help us to determine what we can do to prevent those from recurring. So sometimes it's a dietary change and things like that in order to prevent a recurrence of those urinary stones. But interesting case, but easy solution, and we help this dog a lot.